and he has been voted top doctor in New York for many, many years, and we are delighted to hear how he does it and how he integrates laser treatment of skin cancer into his practice. Thank you so much for coming.
Good morning, ASLMS. I'm glad to be here. My name is Dr. Bruce Robinson. I am in private practice in New York, and I would be remiss if I didn't thank Julian Nanny, who's with us today. With this talk would never be possible. I have received no financial services or reimbursement for any of the studies that you'll see. So as we know, keratinocyte carcinoma accounts for more than 5 million skin cancers a year. And these are the commonly used treatments until my patient Tom. He is of Celtic background, had about 25, 30 skin cancers, both basal and squamous cell on his body, until he had 2 on his forehead. And I knew I needed to do better. I went to bed that evening. I said, let's think about this. And in the middle of the night, I woke up and wrote laser on a sticky pad to remind me in the morning, and also to allow me to go back to sleep so I wouldn't ruminate about it, to figure out how we could help him. So, as my esteemed colleague, Matt Avram, has done a multitude of research regarding the treatment of actinic keratoses and the prevention of basal cells and squamous cells with the fractional laser, we decided to use the 2 wavelengths in fractional laser and employ the ointment, dermatologist ointment, in the treatment of the skin cancers. So in less than 5 minutes, under local anesthesia in our office, and then the nightly application starting immediately that evening of the ointment, we came up with this treatment. This is basically an animation of what we believe is happening with the fractional laser. As you can see, it destroys in part the skin cancer, leaving these microthermal zones to allow the ointment to better penetrate into the skin cancer, causing resolution of at least part of the skin cancer, and also yielding excellent functional and cosmetic results. Not going forward. That's good, thank you. So we knew that there must be something more happening here. And if you look into the literature, there's a heat shock protein response if you reach 42 degrees Celsius or greater in the skin. And that unleashes your body's immune system, whether it's regarding P53, interleukins, nitrous oxide, to help us better destroy the skin cancer. And then in addition, we employed dermal thermography, and we calculated the actual temperature in the skin. And I'm happy to tell you that in most cases, if we got to 42 degrees Celsius or higher for more than 30 seconds, we could almost guarantee the resolution of the skin cancer. So let's go to the stats. We have 230 carcinomas and 148 patients. The demographics are there, and we have a 97.8 success rate. Well, what does that mean? We biopsy patients a month, 6 months, and then once a year thereafter the treatment. The 1.7 failure rate demonstrates a positive biopsy at a month, meaning to us that the treatment didn't work at all. And then the recurrence rate was basically anybody who was biopsied after a month who had a negative biopsy at a month, but subsequently a positive biopsy for skin cancer thereafter. I would like to accentuate the fact that all squamous cell carcinomas in situs and all superficial basal cell carcinomas completely resolved. There were not any failures or recurrence rates with those. So what to expect? This is somebody obviously with very bad sun damage on an arm, and these are 2 sites which you can see right afterwards. There's no oozing, there's really no much of an open wound. And we have to tell the patients that it could take slightly longer to heal than, let's say, a excision. It could take 2 to 4 weeks. The best results have been on the face, and there are a small risk of hypertrophic scar, which we're trying to manage with the amount of heat we generate in the skin. This is a woman from New Hampshire who came to see me, and as you can see, she has a nodular basal cell by the upper right bridge of her nose. This is the first few days of treatment with the topical ointment, gets more red and inflamed, but if you look at day 22, it's almost resolved, and by 1 month, other than having a little erythema, you could hardly tell that there was a skin cancer there at all. This is a young woman from North Carolina. She's 49 years old, was told she needed an O to Z flap on her chin. She found us, and basically at 15 days, her skin cancer basically was resolved, and 1.5 months would be very difficult to find. This is a 55-year-old woman from Florida who had a basal cell carcinoma in the medial canthus of the eye, was told she would need extensive plastic surgery, and as you can see, it is quite inflamed by day 5, but by 2 weeks, it's pretty much resolved, and by 2 months, again, would be very difficult to find. A woman in her 70s with an invasive squamous cell on the frontal scalp at the hairline. This is a basal squamous cell on the ear. And I'd like to bring your attention to this slide. We often have difficulty in patients over the anterior lower leg with healing, whether it be an older patient with poor skin turgor and ripping through stitches, or in a younger woman who really doesn't care for a scar at all, or even a man for that matter. She was so ecstatic, this 44-year-old woman, that she only had some post-inflammatory hyperpigmentation after the treatment. So the benefits, I put them into different categories. So one category would be patients who are elderly, who are on blood thinners, who don't need to stop their blood thinners, or perhaps on a pacemaker where we don't have to worry about electrodesiccation because there's really no bleeding, and really decreased anxiety. These patients who've had Mohs surgery before do not want to sit in a doctor's office wondering if they have to go back for a second pass or for more than a day. Then we have our patients who are very physically active, especially in this current environment with longevity, who want to get right back to the gym, play golf, play tennis, and they can resume all their activities. And lastly, we have a great population now that travel the world. They cannot come back in 10 days for suture removal, and this really does not necessitate that at all. But perhaps the most unifying entity between all patients is the quickness of the procedure. You mean it's done? Or the fact that the cosmetic result is excellent. So the nuisances definitely takes a little longer to heal. We definitely have some hypertrophic scarring, again, which we're trying to manage, mainly on the chest, and some post-inflammatory hypo and hyperpigmentation. Wound care is also essential. Mohs has been the standard of care today. It was found in the 50s, but it wasn't really used in the 80s. And as you can see, even in this patient, unfortunately, Mohs leaves some scarring. And as my esteemed colleagues on the panel have already shown, that causing injury to the skin with lasers not only help with clearing skin cancer, perhaps, or at least precancerous growths and preventing skin cancer, can help manage the cosmetic results. So here we have on the right, a patient who came to me from Long Island, clearly has a depression from the biopsy, and after the treatment and the healing, you can see that not only is depression gone, but his skin cancer is resolved. This is our paper that we published initially in October of 2024. We are now compiling our rest of our results now that we've ended year 3, and we'll be submitting that shortly. So I include this poem by Ralph Waldo Emerson, especially because of the one line, to make one life breathe easier. That's really what we're doing. We're not only treating basal cell and squamous cell carcinomas, we're easing fear, we're preserving cosmesis, and sometimes sparing patients really invasive procedures. This slide with my staff and my family reminds me that none of this happens alone. It's a collective effort. So when we think about outcomes, it's just not clinical results. Wait for it. It's that moment when the patient exhales. I would like to thank the ASLMS and be grateful that I'm a part of such an esteemed organization, and my very esteemed colleagues for having me here. And thank you all for always trying to make one life breathe easier. Thank you for your attention and your time.